Hello friends, now we discuss about cancer fight from Hiroshima to Houston's question and answer. Let's see. First question. How did Hiroshima become a part of world history? Answer. Hiroshima became a part of world history during the final stages of World War II in 1945 when America dropped the atomic bomb on Hiroshima. Many lives were lost, innumerable people suffered from the cancer of the blood or bone marrow. Second question. What are the three traumatic events of Rutusko's childhood? Answer. The three traumatic events of Rutusko's childhood were the atomic bomb explosion on her native city Hiroshima on 1945, the deaths of about half her relatives, including her father, and the death of her most intimate friend Sadako Sasaki at the age of, as a result radiation related blood cancer. Question number 3. What were the results of three experiences of for Rutasko? Answer. The result of these three experiences for Rutasko were her vow to become a cancer doctor. Her dream came true and she became a famous cancer specialist. Next, question number 4. What is Dr. Komaki's specialization? Answer. Dr. Komaki's specialization was the application of radiation creatively in the treatment of cancer. Question number 5. What is she famous for? Answer. She is famous as one of the world's leading researchers and advocates of proton radiation beam therapy. Question number 6. How do oncologists view proton radiation beam therapy? Answer. Oncologists view proton radiation beam therapy as the safest and most effective. Next question. Question number 7. Why does she prefer to work in a university? Answer. She prefers to work in a university because she can do her work much better in the backdrop of university program which is not available at private institutions. Question number 8. Do you think she likes to teach? Why do you think so? Answer. Yes, she likes to teach because she is interested to share her knowledge with future scientists who introduce new ideas of teaching. Idea of think, things. Question number 9. What is she more interested in? Research and patient care or money? Why do you think so? Answer. She is more interested in research and patient care than money. Here focus on proton radiation therapy to treat cancer patients her keen interest on sharing her knowledge with future innovators and her desire to create awareness among all sorts of people concerning healthy lives splendidly exemplify this fact. Question number 10. What is your mission in life? Answer. Your mission in life is to educate younger people, students, trainees, and patients to lead healthy lives and achieve their objective to help others. Next question, question number 11. Explain the meaning of this expression. She no longer fears it. Answer. The atomic bomb explosion on her native city was devastating. It resulted in the loss of innumerable lives, including his relatives and father. They all died of radiation related cancer. Komaki was shocked. Later, he has learned the technique of applying radiation in an innovative manner and hence no longer fears it. Next unit 2, question number 1. What different kinds of therapies were used for treating cancer before the use of proton therapy? Answer. Different kinds of therapies such as surgery, radiation, chemotherapy, and photon therapy were used for treating cancer before proton therapy. Question number 2. What did Komaki initially learn about treating cancer? Answer. Komaki initially learned that surgery was the only possible method for treating cancer. Question number 3. What did she learn about cancer treatment in the USA? Answer. In the USA, she learned how radiation therapy was meant for cancer treatment. Question number 4. What two things did Komaki learn about radiation? Answer. During her stay in the USA, she learned that localized radiation treatment was not so harmful as chemotherapy in the treatment of cancer. Besides, she was aware of an important thing. It was quite different from radiation therapy. Question number 5. How did Komaki and her husband start proton therapy at Anderson Cancer Center? Answer. Proton therapy research in the Proton Treatment Center at Loma Linda University Medical Center in Southern California greatly interested Komaki and her husband. They visited Loma Linda to try their best to open a similar unit at UTMD Anderson in Houston. Their efforts were rewarded in 2006. The $125 million Proton Therapy Center came into existence, paving the way for a complete range of proton treatments. Next question, question number 6. When did proton therapy first start? Answer: Proton therapy first started in 1954. 7. What is Komaki's opinion on proton therapy? Answer: In Komaki's opinion, proton therapy is of great importance to the future of cancer care. The patients she views can lead a normal life during treatments. Next, match each word with its definition. Go back to the next text for clues. B. Then put the head words in alphabetical order. Answer. First question, bit 1. Cell is the smallest part of our body. That means cell. What is cell? Cell is nothing but the smallest part of our body. Next, clinical trial, scientific testing and assessment. Next, collateral damage means unexpected harmful side effects. Innovators, people who create something new. Oncologists, doctors who treat cancer. Penetrate, to enter inside something. Next, radiation, a form of energy that comes from nuclear reaction. Next, scattered means dose spread all over. Target, objects to be hit. Therapy means treatment. Toxicity, quality of being poisonous. Next, we discuss about now. This is all about question and answer of the cancer fight from Hiroshima to Houston. We discuss next chapter in next videos. Thank you for watching. Jai Jagannath.